We're here at Atlantic Health Systems, home of Atlantic Sports Health, with Dr. Damian Martins and my son, Dan. Really here to talk about the experience I had with Dan. Dan's a competitive athlete at Don Bosco. He's a football player. He's a track and field athlete, javelin thrower, and experienced a situation where actually he fell in a snowboarding accident not too long ago and thought it might have been an issue. Why don't you kind of explain that, Dan?
Oh, yeah. So I was snowboarding, I think, in Vermont, and I fell, I kind of jumped, and I landed back on my right shoulder. And then at first I didn't feel that bad, but then the pain didn't go away. It got worse over the next few days. So I told my dad, and I was pretty nervous, thinking it could be something severe, maybe be a tear or something. So we came in right to Dr. Martins.
Fell snowboarding, fell back, braced yourself, felt your shoulder drive up, had more tricep pain and discomfort. Yeah. Were you able to continue after that happened?
Yeah, I did.
Okay. And then when did you start having pain? That night? The next day?
Yeah, that night, I guess.
That night you started having pain and discomfort? Okay.
It wasn't just the first few days, it was only a little bit of pain. I got MRIs, X-rays. Yeah, looked at me, and we figured it out. It wasn't a tear, so I was really happy hearing that, knowing that it could have been a tear, and especially that I'm a javelin thrower. If I tore my throwing arm, my labrum on my throwing arm, that would have set me back tremendously. So finding out that it wasn't torn, and finding out the news within a few hours of coming in was great. Because I was really nervous, so it helped me a lot.
That's great. Dr. Martins, why don't you walk us through that day?
Sure.
And not just Dan. You don't have to be Bill Parisi to come in and get this service, because we've referred hundreds, if not thousands, of people over the last 10 years plus. We talked George Alexandris, some injuries are more severe, his Achilles, diagnosed that. But walk us through the process,
Sure.
Something like Dan.
Well, as we spoke about earlier, Bill, I think you have to understand the athlete as a total person, right? And so athletes, like most patients, they want timely information, and they need help navigating the healthcare system, which is complicated. And that's really what we've created here. Our Atlantic Sports Health program, arguably one of the best in the state. Thanks to the great support of our hospital system, we've been able to create this one-stop shopping with physicians, ancillary services, advanced diagnostics, physical therapy, performance lab, et cetera. And so when we get the call, we know the most important thing is to get that patient, get that athlete in as soon as possible, and take them through that process. And so with your son in particular, we were able to quickly sort of navigate that process and come up with the correct diagnosis as quickly as possible to give them the confidence that there's nothing serious that's going to be career-ending or season-ending.
Yes.
But also put them on the right path in terms of recovery and rehab. And so whenever you give bad news, people don't typically hear anything after that.
Yeah.
And our job is to make sure that we're really giving the coherent information, the correct information, but giving the athlete a roadmap for success.
Yeah.
What are we going to do after the fact?
Yeah.
And I think we've been able to fine-tune that skill here.
Yeah. And again, I was amazed, because referring people compared to just going through it myself, and like Dan said, being able to go through these different tests all in the same day, all within a few hours, was just truly remarkable. And the technology that you have, the access all in one building, is another huge plus, opposed to making multiple appointments at multiple days and scheduling and whatnot. To me, that's incredible. We've had a number of athletes experience that same type of service. Like I said before, some with good news. Hey, like Dan, we got lucky. Mm-hmm. Others with devastating news, ruptured Achilles, and then putting a plan together immediately once we find out that information, what you guys have done, for, say, someone like George, scheduling a surgery, managing, helping with the rehab, all that. It's been seeing it on both sides, both ends of the spectrum. For me, with people that are really close to me, has been amazing. And again, all the athletes that we've sent here has been truly remarkable. So thank you so much for taking the time. Dan, glad to see you working hard. He's got those one-arm push-ups that he's banging out now in full force, thanks to knowing the information and all the programs we've put together in conjunction with your great team. Thanks so much, guys.
Very welcome.